Welcome to the deep dive. Our goal is to take your source material, articles, research notes, all that stuff, and really extract the core knowledge you need so you can get informed quickly and deeply.
And today, we're really digging into something vital. The role of movement. And I mean, all kinds of movement, not just gym workouts in managing type 2 diabetes.
Yeah, and our main source here is, well, it's a pretty major document. It's the official consensus statement from the American College of Sports Medicine. It's an update on their thinking from, 2010, based on a whole lot of new research.
That's right. And what's really key about this one is that it broadens the scope beyond just structured exercise. It explicitly includes physical activity generally, and critically, it also looks at the impact of just, sitting too much sedentary time.
Okay, so our mission then is pretty clear. We want to cut through the sometimes dense scientific language in this statement and give you the essential insights. How does moving your body actually affect type 2 diabetes, the complications, your overall health? Let's unpack it.
Right. Let's start with just the sheer scale of this challenge. Diabetes worldwide, it's affecting, over 463 million people. Yeah. It's genuinely a global issue.
And here in the U.S. alone, about 10.5% of people have it. And when we say diabetes, mostly we mean type 2. That's like 95% of all cases here. Huge numbers.
Absolutely huge. And for anyone managing type 2, the treatment goals are, they're personalized, of course. But the main aims are usually managing blood glucose, reducing that major cardiovascular disease risk, heart attacks, strokes, and also screening for those microvascular complications.
Things affecting the eyes, kidneys, nerves.
Exactly.
Yeah.
And the typical approaches involve lifestyle changes, different medications, and sometimes even bariatric surgery. This statement really zeroes in on probably the most accessible lifestyle tool, physical activity.
So let's get into the mechanics. How does moving actually work on a biological level to help with type 2 diabetes?
Okay, so this is fascinating. When you're active, your muscles, the ones doing the work, they start pulling glucose directly from your blood. And the key thing is they use pathways that don't need insulin to work.
Okay, so that's key then. It sort of bypasses the insulin resistance issue.
Exactly.
At least while you're actually moving.
Right. It's like giving your muscles this direct line for glucose.
Yeah.
And the benefits don't just stop when you stop moving. The improvement in insulin sensitivity, meaning your body responds better to insulin again, maybe systemically, and even in the liver, that can last anywhere from, say, 2 to 72 hours after you finish.
Wow, up to 3 days from one session.
Potentially, yes. And the amount of activity, the duration and intensity seems linked to how long that blood sugar lowering effect lasts.
So consistency really pays off then?
Massively. When you make it a regular habit, the effects really stack up. It's not just about glucose uptake anymore. Regular activity actually seems to improve the function of your beta cells in the pancreas, the insulin producers. It boosts long-term insulin sensitivity, makes your blood vessels healthier, and might even positively affect your gut microbiome. All these things work together for better diabetes management and lower risk down the line.
That's amazing. From pancreas to gut health, just through movement. Now, the statement breaks down different types of activity. We often think exercise, like planned sessions, but you mentioned it covers all physical activity.
Exactly. Let's look at the specifics they outline. First, aerobic exercise. Walking, jogging, swimming, cycling, even short-term training improves insulin sensitivity and how well your mitochondria, your cells' power plants, work. The statement mentions that just a week of vigorous aerobic activity can improve blood sugar, even if you don't lose any weight.
But the real magic happens with consistency, right? The meta-analyses.
Right. The compiled evidence confirms regular aerobic training significantly improves overall glycemic control. It helps flatten out those daily blood sugar spikes and can lower your A1C, that long-term average, by a solid 0.5 to 0.7 percentage points. That's quite meaningful.
And that's on top of benefits for cholesterol, blood pressure, fitness, even without major weight loss, which is really encouraging.
It is. It underscores that activity itself is powerful.
Okay, what about building strength? Resistance exercise, lifting weights, bands, body weight stuff?
Yeah, resistance training is crucial too. The typical benefits are improved strength, obviously. Better bone density, blood pressure, lipid profiles, more muscle mass. And for type 2 diabetes specifically, it gives a good boost to insulin sensitivity, maybe around 10–15%.
And combined with weight loss.
The statement notes it can be even more effective then. One study in older adults found combining resistance training with modest weight loss led to a 3 times greater A1C reduction compared to just weight loss. Pretty impressive.
Does how hard you lift matter, like heavy versus light weights?
It seems so. The research leans towards higher intensity resistance training, potentially being better than low to moderate intensity for improving glucose and insulin numbers. So really challenging those muscles seems to provide a bit more bang for your buck, metabolically speaking.
Okay, so aerobic is good, resistance is good. What if you do both? Combined training.
That's often seen as the gold standard. This document suggests that programs combining both aerobic and resistance might actually be better than either one alone for lowering A1C. You might also see greater benefits for weight loss and aerobic fitness. Meta-analyses generally support this idea. Combined training potentially yields the biggest A1C improvements.
Now, this next one gets a lot of buzz because it's efficient. High-intensity interval exercise, or HIIE. Short bursts, hard work, then recovery.
Right, HIE. It's definitely positioned as a time saver. And the benefits can be immediate. Just one session can help knock down that blood sugar spike after a meal postprandial hyperglycemia.
And there was that interesting timing thing.
Yeah, this was fascinating. Some research suggests that doing interval training in the afternoon might lower blood glucose more effectively than doing it in the morning. Morning sessions, especially fasted, sometimes even cause a temporary rise in glucose. Needs more research, but it's an intriguing finding.
And long-term benefits of HIE.
Improved fitness, A1C, BMI. One study compared it directly to continuous walking and found HIE led to better fitness, body composition, and glucose control measured by continuous monitors. It also seems to boost insulin sensitivity and beta cell function.
Any downsides?
Well, it can cause a brief spike in blood sugar right after the session for some people, so you need to monitor your own response, particularly when starting out. But overall, the potential payoff is significant. Even relatively low amounts of HIE can improve mitochondrial capacity, lower A1C and heart disease risk factors with less time commitment, and even improve heart structure and function and blood vessel health.
And it's not just these main categories, right? The statement mentions other activities too.
Definitely. It highlights things like yoga, which shows promise for improving A1C, lipids, and body composition. Tai Chi might help with blood sugar, balance, symptoms of neuropathy, and just general quality of life.
What about basic flexibility and balance?
Flexibility work is great for range of motion, makes other activities easier, helps counteract stiffness. It doesn't usually impact blood sugar much on its own, unless it's part of something like yoga. Balance exercises, though, are super important, especially for reducing fall risk, which is a concern with diabetes, particularly if there's nerve damage. Improving balance and how you walk directly tackles that risk.
And Pilates got to mention too.
Yes, potentially helpful for blood glucose management and functional ability, especially in older adults.
Yeah.
So the takeaway is really that a broad spectrum of movement contributes something valuable.
Okay, this next point feels really crucial, and you touched on it earlier. The idea that physical activity works even if you don't lose much weight.
This is such an important message from the statement. Yes, intensive lifestyle programs combining diet and activity often aim for weight loss, and weight loss is definitely beneficial. We know from the big diabetes prevention program, the DPP study, that every kilogram lost cut the risk of developing T2D by about 16%. That's significant.
So weight loss helps, no question. But the activity part.
The activity part adds its own layer of powerful protection. In that same DPP trial, people who hit the physical activity goal slashed their diabetes risk by 44%, even if they didn't lose much weight. And folks who started out less active saw the biggest benefit. It shows that just getting moving makes a huge difference.
The document mentions the Look Ahead trial, which focused on more significant weight loss, over 5%. It notes that hitting that level seemed necessary for the biggest drops in A1C, cholesterol, and blood pressure.
That's true. And while Look Ahead didn't ultimately show reduction in major heart attacks or strokes long-term in that intensive group compared to standard care, those participants did have fewer hospital stays, needed fewer medications, and had lower healthcare costs. So substantial benefits were still there, just maybe not on that primary heart event endpoint.
And even without big weight changes, physical activity is really good at targeting that dangerous belly fat, the visceral fat around the organs.
Exactly. Moderate to high-intensity exercise, maybe burning around 500 calories 4 to 5 times a week, is particularly effective at shrinking that visceral fat. And reducing that fat directly lowers metabolic and cardiovascular risk. So your overall weight might not budge much, but your body composition can improve in really critical ways.
Beyond the direct effects on diabetes and heart health, this statement talks about other important health wins from being active.
Yes, several key areas. One is preventing gestational diabetes, GDM, during pregnancy. Women who develop GDM have a much higher risk of getting type 2 diabetes later on. Physical activity is a great tool here.
How strong is the evidence for that?
Pretty strong. Exercising before pregnancy is linked to lower GDM risk. And continuing moderate aerobic activity during pregnancy helps reduce the chances of developing GDM and gaining excessive weight.
So it's safe and effective during pregnancy.
Yes, the consensus is very clear on that. One review found that doing about 140 minutes of moderate activity per week during pregnancy cut the risk of GDM, preeclampsia, and high blood pressure in pregnancy by about 25%. Any type of regular activity seems beneficial and safe.
What about mental health and brain function?
Also significant benefits here. Regular physical activity is known to reduce symptoms of depression and anxiety in people with type 2 diabetes. Exercise actually boosts brain chemicals that support plasticity in the hippocampus that's crucial for learning and memory.
And the Look Ahead trial showed mental health benefits too, right?
It did. Even though it didn't hit that main CVD goal, the lifestyle group reported better health-related quality of life and fewer depression symptoms. And those benefits lasted for up to 8 years. That's really quite something.
And cognitive function, diabetes can affect that.
Yes, T2D is linked to cognitive difficulties. While more research is always needed, meta-analyses suggest exercise has a positive, if maybe small to moderate, effect on things like executive function and memory. Being physically active seems to help counteract some of that cognitive decline associated with diabetes.
Okay, so with all these benefits laid out, what are the actual recommendations? The statement mostly follows the general U.S. physical activity guidelines, but adds some specific points for T2D.
Right. For adults and older adults doing aerobic activity, the main guidelines apply. But there's one really key modification. Try not to go more than 2 consecutive days without any aerobic activity.
Because of that short-lived insulin sensitivity effect, the 272 hours.
Exactly. That guideline aims to keep those benefits topped up consistently. And of course, for people with other health issues or older adults who might be frail, the advice is simply to be as active as possible within safe limits.
And resistance training.
Again, follow the general guidelines. The statement reinforces the benefits: strength, muscle, bone density, lipids, blood pressure, insulin sensitivity. And it highlights that potential for bigger A1C drops, especially in older adults, if combined with some weight loss. And as we said, combining aerobic and resistance might be the most effective strategy overall. If meeting the full targets is hard, focusing on functional fitness and balance is still valuable.
What about flexibility?
Highly recommended for general well-being. It helps with joint stiffness, which can be worse with age and high blood sugar, and makes it easier to do other activities. It's usually low intensity, so it's accessible, but doesn't directly impact glucose much unless it's part of, say, yoga.
And balance is crucial, especially with neuropathy.
Absolutely. Many resistance exercises help with balance, as does power training. But specific balance exercises, even simple ones at home, are really effective at improving gait and reducing that fall risk.
Okay, moving beyond planned exercise, this updated statement really hammers home the importance of reducing sedentary time, just sitting less.
This is a massive takeaway from the recent research. Prolonged sitting is a significant independent risk factor for type 2 diabetes across diverse populations. The source cites data suggesting every extra hour of daily sitting time bumps up the odds of T2D by about 22%. And crucially, this risk is separate from how much formal exercise you do or how fit you are.
So you can hit the gym but still be at risk if you sit all day.
That seems to be the case. It's a distinct risk factor. So the big recommendation is to interrupt prolonged sitting. Taking short, frequent breaks, we're talking just 3 minutes of light walking or simple resistance moves every 30 minutes, can noticeably lower those post-meal glucose and insulin surges and even help with triglycerides.
Some studies even suggest replacing sitting with standing or light activity might be more effective for 24-hour glucose control than one structured workout.
It's a fascinating finding, yes. It really highlights the power of frequent low-level movement throughout the day. Things like short bursts of stair climbing, quick 5-minute breaks every hour, even brief activity snacks before meals. All these strategies show promise for blunting those post-meal glucose spikes.
Especially for people with more insulin resistance.
Exactly. These small bouts seem particularly helpful for them. Now, the statement does add a note of caution. We need more studies looking at these activity breaks in real daily life to confirm the long-term clinical benefits for blood sugar control. But the short-term physiology is really compelling.
What about kids and teenagers with type 2 diabetes?
The general activity goal is the same as for their peers without diabetes. But implementing lifestyle changes can be really tough for young people because of complex social factors, school environments, family habits. And unfortunately, T2D that starts in youth can often be more aggressive.
But exercise still helps them.
Oh, absolutely. Exercise and nutrition programs have shown they can reduce insulin resistance and T2D risk in kids and teens with obesity. Supervised exercise programs have specifically improved blood vessel health endothelial function in adolescents who already have T2D. So promoting both home and gym-based activity is really encouraged for their insulin sensitivity, heart health, and weight management.
Okay, safety is always a big concern. What are the key safety points for people with T2D being active?
Good question. For starting low to moderate activity, like brisk walking, most people don't actually need a special medical checkup beforehand, unless they have symptoms of heart disease or significant complications like severe neuropathy.
But for more intense activity?
Yes, if you've been largely inactive and want to jump into moderate to high-intensity workouts, getting medical clearance first is definitely the prudent approach.
What about routine stress tests before starting exercise if you don't have symptoms?
The statement says that's still a bit controversial. Studies haven't clearly shown that doing routine stress tests on asymptomatic adults with T2D actually prevents major heart events down the road. It's also interesting that resistance exercise seems less likely to cause ischemia-reduced blood flow to the heart than aerobic exercise at the same perceived effort level.
Managing blood sugar highs and lows during activity is obviously critical, especially with meds.
Absolutely central. The risk of hypoglycemia or low blood sugar is pretty minimal if you're managing T2D with just lifestyle. But if you use insulin or medications that make your body release more insulin like sulfonylureas, the risk goes way up.
So careful planning is needed.
Definitely. You need to think about adjusting your insulin dose, timing it right, maybe having some extra carbs before, during, or after activity, and be aware of potential delayed hypoglycemia lows that happen hours later, especially after longer or more intense sessions. Less common for casual exercisers not on insulin, but a real possibility. One interesting tip for insulin users. Sometimes ending a workout with a very short, high-intensity burst without taking extra insulin might actually help prevent later lows.
And the flip side, high blood sugar, hyperglycemia.
If your blood glucose is really high, say over 300 milli-GDL, you need to be cautious, especially if you also have ketones present, although high ketones are less common in T2D than type 1. If you feel okay, you're well hydrated, and ketones are low or negative, light to moderate activity is generally all right. Intense exercise can sometimes temporarily raise blood sugar.
What about managing that?
Sometimes a bit of extra insulin or a longer, lower intensity cool down can help bring it down, but it's often not needed. There's a really important warning, though, regarding SGLT2 inhibitors, a newer class of diabetes meds. You could potentially develop diabetic ketoacidosis, DKA, with elevated glucose, even if it's not sky high when taking these drugs. So if you're on an SGLT2 inhibitor and your glucose is up, only exercise if you feel perfectly well otherwise.
Heat is another factor to consider carefully.
Yes, very important. T2D can impair the body's natural cooling mechanisms, sweating and widening blood vessels. This makes people with T2D more susceptible to heat stress during exercise and less able to tolerate activity in hot conditions. Dehydration also makes high blood sugar worse. Plus, other health conditions or medications might add to the risk. You can acclimatize to heat with regular activity, but extra caution is always wise.
And if someone already has complications like heart or kidney or nerve issues,
Most people with existing macrovascular or microvascular complications can still exercise safely, but specific precautions are essential. The statement actually provides detailed tables on this, outlining which activities might need modification or be contraindicated based on the specific complication. Screening for things like underlying heart disease or cardiac autonomic neuropathy should just follow standard clinical practice.
okay, let's shift slightly to timing and diet. Does when you exercise matter?
It can, especially for managing those post-meal blood sugar spikes. Exercising after eating, postprandially, often provides better immediate glucose control. Studies have shown benefits with aerobic activity after breakfast or resistance training after dinner, for example. Aiming for a decent duration, maybe 45 minutes or more after the meal, seems to give the most consistent results.
And we mentioned that afternoon HIIE finding earlier too.
Right, so the specific timing might offer advantages depending on the type of activity and the individual. And of course, diet is inseparable from this. Sustainable, healthy eating plans, considering carbohydrate amount and timing combined with activity, are the cornerstone of managing glucose, insulin sensitivity, weight, and heart risk. Patterns like the U.S. dietary guidelines, emphasizing whole foods, are generally recommended.
What's the take on popular diets like keto or intermittent fasting?
The statement acknowledges that carbohydrate restriction works for lowering blood sugar and weight. However, it cautions that really popular approaches like strict ketogenic diets, under 50 DO carbs day, or various intermittent fasting schedules need more high-quality research, specifically in people with type 2 diabetes. Especially keto, its long-term effects and impact on exercise performance in this group aren't fully clear, so caution is advised.
Now, medications and other treatments, how do they interact with exercise?
This is a really interesting area with some surprising findings. Let's start with metformin, the most common T2D drug. Some preliminary studies, mostly in healthy adults initially, suggest metformin might actually blunt some of the beneficial effects of exercise.
Really? Blunt the benefits? How?
Potentially things like improvements in insulin sensitivity, mitochondrial adaptations in muscle, even muscle growth from resistance training. It might also slightly reduce how much exercise lowers post-meal glucose in people with T2D using it. It seems to interfere with some cellular signaling pathways activated by exercise. But the statement stresses more research is definitely needed to understand the real-world clinical significance of this. It's intriguing, though.
Very counterintuitive. What about other diabetes meds?
Newer classes like GLP-1 agonists and the SGLT2 inhibitors we mentioned also have complex potential interactions with exercise physiology that are still being studied. But the main practical point remains for users of insulin or insulin secretagogues. Careful management of carbs and medication is crucial to avoid lows.
And non-diabetes medications like blood pressure meds.
Beta blockers are common. They lower your heart rate response to exercise, which can affect capacity and mask hyposymptoms. But paradoxically, they might improve exercise tolerance in people who have T2D and heart disease by reducing angina or ischemia. The key takeaway if you're on a beta blocker is to use the rating of perceived exertion, or RPE, how hard it feels to guide your intensity, not just heart rate.
And statins. Cholesterol drugs.
Statins are linked to muscle issues, pain, inflammation called myopathies in a small percentage of users. The risk might be slightly higher if combined with certain other drugs or if blood sugar is poorly controlled.
The statement also covers bariatric surgery.
Yes, it emphasizes that bariatric surgery is currently the most effective long-term treatment for significant weight loss and achieving T2D remission in many individuals. And exercise is seen as a vital partner to surgery, both before and after.
How does exercise help around surgery?
Pre-surgery exercise might lower surgical risks, improve recovery, potentially shorten hospital stays, and boost fitness levels going in. And post-surgery exercise is absolutely critical for maintaining the weight loss, maximizing improvements in blood sugar control and insulin sensitivity, further reducing heart disease risk, and improving blood vessel and heart function. Resistance training in particular is important after surgery to help rebuild muscle strength and counteract some of the bone density loss that can occur with rapid weight loss.
Okay, the final section of the statement deals with something incredibly important: the real-world barriers and the significant inequities related to physical activity.
This is absolutely crucial context. The barriers people with diabetes face are often similar to others. Maybe low confidence or self-efficacy about being active, difficulty setting realistic goals, lack of access to affordable or convenient facilities or expert supervision, not enough social support, sometimes cultural norms, and of course other health problems like obesity itself or painful osteoarthritis can make activity feel much harder.
The environment plays a big role too, doesn't it?
A huge role. The built environment, things like having safe sidewalks, parks, bike lanes, green spaces, accessible gyms, or community centers makes a massive difference in whether people can be active easily and safely. Creating activity-friendly environments is key. And on an individual level, things like setting achievable goals, starting slow, getting positive feedback, especially from healthcare providers, and having some supervision or support can really help build that confidence and make activity stick.
And the statement is quite direct about the inequities.
Yes, it confronts this head-on. It highlights that physical inactivity, obesity, and type 2 diabetes rates are significantly higher in several racial and ethnic minority groups in the U.S., specifically citing non-Hispanic Blacks, American Indian Alaskan Natives, and Hispanics compared to non-Hispanic whites. And it's very clear. These disparities are overwhelmingly driven by social and environmental factors, not by inherent biological differences.
What kind of factors contribute to these disparities?
Things like under-resourced schools with limited PE, lack of safe parks or recreational spaces in certain neighborhoods, poor infrastructure for walking or cycling, concerns about neighborhood safety, and easier access to unhealthy food options compared to healthy ones. It's a complex web of systemic issues. Conversely, research shows that living in communities designed to promote physical activity is linked with lower rates of type 2 diabetes.
So addressing these disparities requires more than just individual advice.
Absolutely. It requires targeted efforts focused on changing those environmental factors, addressing systemic inequities, and ensuring health resources are distributed fairly. It's about creating opportunities for everyone to be active. Understanding this social context is fundamental if we want to genuinely promote health equity and reduce the burden of T2D.
So bringing this deep dive to a close, the overarching message from this ACSM consensus statement is really powerful. It's clear that all sorts of physical activity, planned exercise, yes, but also just moving more and sitting less are incredibly important for managing type 2 diabetes at any age.
Right. The general activity guidelines are a great starting point, but people with T2D need those specific modifications and safety checks, especially if they have complications. And we saw how beneficial exercise is when combined with treatments like bariatric surgery.
And perhaps most importantly, we're reminded to look beyond just individual choices and acknowledge the very real barriers and systemic inequities that make being physically active much harder for some people and some communities than for others.
Understanding this research, all these details, really equips you, the listener, with the knowledge to make informed choices about your own physical activity. It gives you the why behind the recommendations and a lot of the how.
So, considering just how incredibly broad the benefits of physical activity are for type 2 diabetes impacting not just blood sugar, but heart health, brain function, joints, mood, body composition, here's something to think about. What is one small, consistent step you could take starting today to weave a little more movement into your life? And thinking about those wider systemic issues, how can understanding the barriers others face inspire us all to advocate for community environments where being physically active is an easy, safe, and equitable choice for absolutely everyone?